partner, says McKinsey. Those are the headlines for today. On our show today, we'll also have a special segment called Fighting COVID. But first, let's take a look at the weather updates.
This is Maythal Shukaili with your daily weather update. And right now, I'm outside the TFM studio in Al Khuwair. Before we move on to weather, here is our fact for the day. The chance to be fatally struck by lightning is actually before you see the storm. Lightning has the ability to travel horizontally over 6 miles. That is our fact for the day. Now let's step inside the studio and talk more about weather. An alert has been issued by Oman Meteorology and Civil Aviation Authorities saying that there will be poor visibility due to the fog formation, and there will be mainly clear skies over the rest of the Sultanate with possible high and medium advection clouds over the northern governorates. And there's chances of late night to early morning low-level clouds or fog patches over Al-Wusta, South Al-Sharqiyya and Dhafar. And now let's move on and take a look at how the weather will be like in all the governorates. Muscat will be sunny, temperatures between 28 to 20 degrees Celsius. Musandam will be sunny, temperatures between 26 to 22 degrees Celsius. North Al-Batina will be partly cloudy, temperatures between 29 to 20 degrees Celsius. South Al-Batina will be sunny, temperatures between 28 to 18 degrees Celsius. Al-Buraymi will be sunny, temperatures between 29 to 20 degrees Celsius. Al-Dhahira will be sunny, temperatures between 31 to 19 degrees Celsius. Al-Dakhiliya will be sunny, temperatures between 30 to 19 degrees Celsius. North Al-Sharqiyya will be sunny, temperatures between 29 to 17 degrees Celsius. South Al-Sharqiyya will be sunny, temperatures between 29 to 20 degrees Celsius. Al-Wusta will be partly cloudy, temperatures between 31 to 17 degrees Celsius. And Dhafar will be sunny, temperatures between 26 to 16 degrees Celsius.
Hello and welcome back to Outline. Let's take a look at the local stories. A cooperation agreement has been signed between the Ministry of Higher Education, Research and Innovation and the Public Authority for Special Economic Zones and Free Zones. A statement issued online by Oman News Agency said the following. The Ministry of Higher Education, Research and Innovation and the Public Authority for Special Economic Zones and Free Zones signed a cooperation program to enhance cooperation and integration to align the higher education, research and innovation sector with the current and future development plans of the special economic zones and free zones. Plans to make Wadi Kabir industrial area safer for businesses and the surrounding residents are being drawn up. To make sure fires like the massive blaze which spread through large parts of the area do not take place again, members of the Majlis al-Shura and Municipal Council of Muscat came up with ideas to improve safety standards in establishments operating in the area. Meanwhile, the Oman Chamber of Commerce and Industry has also decided to undertake a study to devise ways to prevent such fires in the future and make sure they can be contained before they cause more damage by spreading to nearby residential areas. Oman is not the country it was 20 years ago, said Hamoud Al-Yahyai, the chairman of Services and Social Development Committee of the Majlis al-Shura, who is in favor of relocating the facilities there to a safer location away from highly populated areas. In light of the increase in population, urban expansion, and the growth in commercial and industrial activities, permanent plans must be drawn up for cities and regions and not temporary ones. This is particularly true when considering urban planning in residential neighborhoods, he added. We must make sure factories, industrial facilities, and tall buildings are kept away from these areas so as to preserve the privacy and environment of those living in residential homes. Plans must also be made accordingly for proper distribution of public services such as streets, water supply, sewage, and electricity. Al-II's committee will discuss this on February 24th with its recommendations on safer industrial areas and then put it to the Shura Council, which will discuss these suggestions with all the members at a later date. This will help provide permanent, sustainable solutions that benefit both the country's economy and its people. Meanwhile, Salim Al-Khamari, a municipal council member for the Wilayat of Mathura, of which Wadi Kabir is a part, said industrial areas need to be properly planned in terms of how operations set up within impact the people and environment in the surrounding areas. Al-Khamari went on to say that the workshops within had been arranged in a haphazard manner, with little consideration given to the safe use, storage and transportation of flammable goods. Scrap metal and other items allocated for repurposing are also stored improperly, he added, and this needs to change. He also added, saying, I don't, however, encourage moving the entire industrial zone to another area because every place needs a small industrial area to meet the needs of his residents. When it comes to day-to-day matters such as changing car tires, repairing vehicles, ordering goods from a carpenter, maintenance and repair of tools, but all of these need to be tightly organized by the relevant authorities who need to supervise such areas in a proper manner, making sure the workers within comply with health, technical, legal and safety requirements. The Royal Navy of Oman on Sunday began conducting a naval drill, Sharp Dagger, at Al Batana Naval Site with participation of friendly countries' navies and assistance of the Royal Air Force of Oman's Rafale jets. The drill will last till February 25, 2021. The drill, conducted as per precautionary measures of COVID-19, comes within the framework of the RNO's annual training plans, besides exchanging experience with friendly countries to sustain the readiness levels of the RNO fleet and personnel on various marine disciplines in line with their national tasks. The naval drill began when the participating ships on Sunday set off from Said bin Sultan's naval base to the site designated for the drill according to the outlined plans. General Kenneth McKenzie, commander of the United States Central Command, lauded efforts of the Sultanate's government under the leadership of His Majesty Sultan Haitham bin Tariq to upgrade the military sector. In an interview with Oman News Agency, the US military official affirmed that the Sultanate is a strategically important partner for his country to maintain regional security. General Kenneth McKenzie explained that the Omani-US relationship is one of the oldest as it goes back hundreds of years, reaffirming his country's keenness to promote this relationship in various areas. He added that during his visit, he toured Qasab Air Base and Musandam Air Base, in addition to meeting with many defense officials in the Sultanate to discuss different military topics of common concern. Those were the local stories. Now let's take a look at the COVID-19 updates. The Ministry of Health has announced the registration of 3 new COVID-19 deaths, taking the total death toll to 1,555. The ministry has extended its deepest condolences to the families of the deceased. The Ministry of Health has also announced the registration of 313 new COVID-19 cases, taking the total cases in the Sultanate to 139,692. In the past 24 hours, there have been 195 recoveries, and the total number of recoveries now stand at 130,848. The ministry has urged everyone to adhere to social distancing instructions issued by the Supreme Committee and the Ministry of Health. As I mentioned earlier, on Outline Today, we have our special segment, Fighting COVID with Madiha Asif. So let's head over to the other studio for more COVID-19 news.
Now, considering the number that Antara just mentioned, today 330 cases were announced, and considering the past week, it seems like the confirmed cases on a daily basis in the Sultanate are increasing once again. However, when you look at the other parts of the world, you still count your blessing that you're still in the Sultanate, because it is still under control thanks to the authorities, including the Ministry of Health, Supreme Committee and Royal Oman Police, who are doing a phenomenal job in controlling and curbing the spread of the virus. In fact, if you all remember that 2 weeks ago, the Supreme Committee had announced the closure of the public beaches and parks, as well as made pretty obvious that only 50% attendance will be allowed at government offices as well as cafes and restaurants in the Sultanate. And they also extended the closure of the border until the situation is back to normal. However, to talk more in detail about how the COVID-19 situation is like, we have very special guests joining us on Fighting COVID today. But before that, let's take a quick commercial break. Welcome back to TTV. You're watching Fighting COVID. Now, before going on the commercial break, I mentioned that we have a very special guest joining us today who will be talking more in details about the COVID-19 situation in the Sultanate. Let's welcome Dr. Prakash K. Patel from the Ministry of Health. Thank you so much, Doctor, for joining us today.
Thank you.
So, Dr. Prakash, you just heard the latest news about the 330 cases, that was just announced today. Considering the cases and, how things have been past 10 days, let's say, how do you define the situation of COVID-19 in Oman?
The overall situation of COVID-19 in Oman is stable compared to the last year. As you remember that 24th February 2020 was the first case which we identified in Oman, and cases began to rise, and it peaked around August, September, and October months of 2020. But since November and December, the cases have been coming down. The overall new infections are low. The recovery rate is very high, comfortably at 93%. And the fatality rate is also acceptable of 1.1%. There is a marginal increase, as you said, in the number of cases and hospitalization recently. And the reporting of new variant of this virus is also a cause of concern. However, the Ministry of Health is well prepared, and we are doing our best to contain the further spread of disease in Oman.
Doctor, the cases are increasing lately. You just said because before the cases were around 100 or 100 plus, a little over 100, because for the past week it's crossing 250, sometimes 300. What do you think could be the cause of this increase in the number on a daily basis?
Yes, there is no single cause for it, for the increase in number of cases. The causes could be multiple. One is globally there is an increase in number of cases and reporting of new variants of viruses from different parts of the world. And second is the lifting of restriction of movement, like lockdown, resulted in increase of movement of people, which increases the chances of exposure. And also people are dealing with pandemic fatigue, what we call, is that people since last 1 year, people are dealing with this situation. So there is a fatigue sets in among the population. And also lastly is the behavioral changes, that is the social gatherings which were there outdoors. Now, because of the lockdown, the indoor social gatherings have increased, and also a certain extent non-adherence to the preventive measures. So, however, these are all some of the causes why the cases are increasing. But this marginal increase in number of cases and hospitalization recently is a concern. But if you look at the number of deaths are consistently decreasing in Oman. There is no increase in number of deaths as far as concerned. And that is the most important indicator to see whether there is any increase in cases or deaths or worry in concern.
Right. Dr. Prakash, you've mentioned few very good points here. One, you mentioned that, one of the causes could be about the indoor gatherings. Do you agree, Dr. Prakash, that, when people are having indoor gatherings, despite knowing that the guidelines issued by the Supreme Committee and the Ministry of Health of maintaining social distancing, hand hygiene, wearing masks, do you think that people actually follow or adhere to these guidelines when they're actually having indoor gatherings?
That is, most of them follow the guidelines, but when you are gathering indoors, people tend to get relaxed because nobody is supervising them. So that is a cause of concern. So that is why nowadays, after the lockdown has been lifted, and repeat partial lockdowns have been done, this indoor gathering is becoming a major issue, and we are trying to tackle those issues also with our health education team and through the media and other modes.
Right. Dr. Prakash, you also mentioned about the lockdown, the lockdown when there is a partial lockdown or, like there is a movement ban in the country that actually helps to bring down the number of cases in the country. Now, with the existing lockdown, not a lockdown, but, North Governorate is in a partial lockdown and there is a closure of border in the country and beaches and parks are closed. Restaurants are not 100% occupied. Do you think with all these measures in place, it will actually help reduce the number of cases?
Definitely it will help bring down the cases or prevent the spread of disease in the community. But this benefit comes with a cost because economic loss will be there. It is a balance. We have to maintain the balance between the lockdown and the partial lockdown, and also allow certain economic activities to go on. It is highly infectious virus. This virus is a very highly infectious virus. The only way to prevent the spread is in the absence of definite treatment, prophylaxis, and vaccine is the restriction of movement. So that is why we allow this partial lockdown to happen once in a while, so that economic activity also goes on and also bring down the incidence of these diseases in the community.
Right. You just mentioned that this is a highly infectious virus. A lot of people, when I talk to people, sometimes they actually say that this coronavirus is more like, getting a flu. What do you have to say to people with that kind of mentality or that kind of image of this coronavirus when they consider this as just a flu and, they take it really easy?
It is more or less similar to flu virus only if you look at the symptoms and other signs. But it is much more lethal when it compared to the people who are, if the people who are with comorbidities like hypertension, diabetes, renal disease, if they get this disease, it could be much more lethal when compared to the influenza virus.
Now, you are a frontline worker yourself, Dr. Prakash, and you're an expert in this field. So what do you think about this virus? Considering the vaccines are here now and people are getting vaccinated already. In fact, past week on Friday, Saturday, the second dose of jab was given to people in Muscat Governorate at Seeb Health Complex and Bosher Health Complex. So the vaccinations are already on a roll. People are getting vaccines. Considering all these scenarios, do you think the virus is here to stay for long?
Right now, it is difficult to say how long this pandemic will last or the virus will stay, because there are a few things. First is that this is a new virus and there is no conclusive evidence. We do not know much about this virus completely. Second is the coronaviruses are known for its variants. Even though vaccine is available, coronavirus changes its characteristics and presents it in a new, different form. And the vaccine effectiveness against the new variants is still unknown. Third is there is no conclusive evidence to say how long the vaccine also protects the individual. And lastly is it depends on other countries' measures and vaccination program also, because you can always import the disease from abroad. So
Right.
These are all the few things which we need to take into consideration. If you see the history of previous virus pandemics like H1N1 or even HIV also, it looks like it will stay for quite some time. Having said that, with the arrival of effective vaccination, we should be able to see the end of this pandemic situation in near future. My guess is that personal, with the experience, is that in coming 10 to 12 months from now, we should be able to have a clear picture about this pandemic situation.
I hope so.
For the complete pandemic to stop, at least we should vaccinate more than 65% of the population in a particular country. So unless that happens, it is difficult to say how long this virus will be staying.
Sorry, Dr. Prakash, you just mentioned about the vaccination. When you're saying 10 to 12% of the population, right? Are you talking about the targeted? Sorry.
We should be vaccinating at least more than 65% of the
65.
population.
Okay, so when you're saying population, that includes the targeted group as well as the non-targeted groups, right?
Yes, targeted group and non-targeted group, especially the people who are susceptible for this infection. So we should cover this susceptible population, for example, more than 50 to 55 years of age group and people who are having comorbidity. So we need to cover these people at least 100% so that the immunity sets in and then the infection also reduces in the community.
Right. Dr. Prakash, we have to take a quick commercial break here, but you all stay tuned as we'll be talking about the new variant with Dr. Prakash after this quick commercial break. Welcome back to TTV. You're watching Fighting COVID. So we are in conversation with Dr. Prakash today, who's telling us how the new variant is actually making headlines across the globe and talking about the new variant. Dr. Prakash, according to the Ministry of Health, so far 6 new variant cases have been detected in the Sultanate of Oman. Are there any more cases or are there more suspected cases that we could see in the future?
Yes, there are a few cases of new variants in Oman. However, all these are imported cases and there is no secondary spread in the community. So MOH is, along with the airport authorities, are ensuring that all the passengers are screened and quarantined as per the guidelines. So even though number of cases are very less in Oman compared to any other country, the new variant is actually making headlines and it is a cause of concern all over the world. That is why the new quarantine guidelines are also have been issued and airport authorities are doing their best to screen and quarantine these people.
So Dr. Prakash, the check for this kind of new variant, is it similar to what we undergo for COVID as well?
Yes, there is no difference in the precautionary or safety measures when it is about treatment or whether it is a precautionary measure or preventive measure it is concerned. There is not much difference between the previous variants and this variant.
Right. And talking about this variant, how to exactly stay from this variant, what are the precautionary measures that you would like to share with our viewers?
See, all these viruses, including this SARS-CoV-2 virus, change over time. They mutate. Most without any direct benefit to the virus in terms of increasing the infectiousness and transmissibility. Coronavirus also has many variants, But recent variants from UK, Brazil, and South Africa is making the headlines because it has been shown that these variants spread very fast, and also there is an increase in mortality among these variants. If you look at the number of variants isolated from all over the world, there are more than 32 variants for these coronaviruses, but only these few UK, Brazil, and South Africa variants are in the news because of their faster spread in the community and also causing the mortality.
Right.
But this epidemiological investigations have shown that it is not a cause of concern because only it has increased the hospitalization, but it has not been able to cause deaths as expected with the new variant.
Right. Talking about this new variant, Dr. Prakash, how different is this new variant from the existing coronavirus variant?
Yeah, as I said, there is not much difference. Only the difference with the new variant is that ability to spread fast and whether it can cause death among the population. But still, this new variant is a new one. We do not know much about it. Epidemiological investigations are underway to see whether it is much causes it spreads very fast or it causes mortality. In terms of treatment and other modalities of prevention, wearing mask, hand wash, social distancing, and travel only if necessary. Avoid indoor and outdoor gatherings are the same. And lastly, with the vaccination, we would like to urge all the eligible people to take vaccination and encourage others also to take vaccination, because now vaccination is the only mode of method we can prevent this disease spreading and also prevent the death.
Right. Dr. Prakash, also, is it true that once you get the vaccination, you can actually go out without the mask? You don't have to maintain social distancing. Are you free from getting infected, or you still have to be more cautious and careful?
No, we need to be more cautious, even though if you have taken the 2 doses of the vaccination, because vaccination is either the protectiveness varies from 70% to 95%. Even though if you person gets 95% protection, that 5% still chances of getting the virus is there. But with the vaccination, we can prevent the case load in the community so that the spread of the disease can be prevented. Yes, even though if you are vaccinated, still you need to take all these preventive measures.
So it doesn't mean that once you're vaccinated, there is no fear of getting infected. If you do not adhere to the precautionary measures, there's still a chance that you can be affected, right?
It is a minor chance, like maybe 5 to 10% of the chances you may get infected. But with the vaccination, even though if you get infected with the virus, the severity of the disease will be less when compared to the non-vaccinated person.
Right.
So it is better to get vaccinated rather than unvaccinated.
Right. Thank you so much once again, Dr. Prakash, for joining us and sharing such insightful information and, stressing on the targeted groups to come forward and get vaccinated. Thank you once again.
Thank you. My pleasure.
This was all from Fighting COVID today. Let's go back to Antara.
Yes, as Dr. Patel said, there has been an increase globally in the cases. This is because of the new variants, the new emerging variants, increase in movement, indoor gathering, and also a new phenomenon called pandemic fatigue, because, of course, it has been almost a year. However, the condition is relatively stable in Oman when it comes to COVID-19. The recovery rate is high and the vaccination drive is going successful. So let's all continue to adhere to the precautionary measures and do our bit to contain the virus. This was Fighting COVID on Outline. We'll be back with midday update tomorrow, so stay tuned.
You've just heard the live feed from the TTV studios on TFM 95.4.